Om Tat Paramparaye Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guruः Prachodayate. Om Yoga Maharshi Dr. Swami Geetananda Giri Guru Maharaj Ki Jai. Om Puduvai Kalaimamani Puduvai Shakti Yogacharya Amma Ji Meenakshi Devi Bhavanani Guru Mata Ki Jai. Om Shri Guru Bhyo Namaha Hari Om. This is a wonderful opportunity for us to contemplate prana. Prana, that is the vital ingredient of life itself. The very fact we are alive is because prana is flowing through us. Prana is the cosmic catalyst that which enables life to manifest in this universe. The loss of prana is death, and the manifestation of prana is life. This evening, I have a wonderful topic which is looking at the scientific aspects of the breath and its relationship to pranayama and the cross connections that are existing with our traditional knowledge system of yoga itself. We all know that we breathe. Well, you tell most people, you come to the class and in pranayama, you will learn how to breathe, and they will laugh at you. They'll say, oh, Dr. Ananda, I already know how to breathe. It is because I'm breathing, right? I'm able to stay alive. And what are you going to teach me new about breathing? Most people think they already know a lot. The first part of learning is to empty the vessel so that we can receive. Because we can only receive that much which has space in our container. And this is why normally we like to ask people, well, why don't you think about how many times you have thought about your breathing since the morning? You ask anyone, you go stand on the corner street and you ask people who are going by, since the morning, how many times have you thought about your breathing? Well, most people are going to say, not at all. And the only people who actually tell you that they have thought about the breathing are those who are suffering from breathing disorders. Because when you have a disorder of a certain bodily system, you become aware of it, but in a negative way. It is a negative awareness that is generated by disease. The other small cohort will be those who have been practicing yoga and especially pranayama. And that is where we will find the positive awareness. So disease giving us a negative awareness of the breath and the breathing process, and yoga giving us a positive awareness, because yoga is all about developing awareness at multiple levels, as my father Guru Swami Geetananda Giri used to tell us always. Yoga is fourfold awareness. Awareness of the body, awareness of the emotions, awareness of the mind, and awareness of awareness itself. What a beautiful way to understand yoga, that we are developing a positive sense, a healthy sense of awareness about this body, which is the vehicle for the divine. We are developing a positive awareness of our emotions, moving from an emotional volatility into a state of emotional balance, and then transcending the emotions and enabling them to grow into a higher intelligent form of heartfulness. And then working with the mind becoming aware of the mind and then transcending the mind also. Because you go through the mind and you go beyond the mind into that beautiful state, a state of awareness itself, a metacognitive state. Now, when my beloved father, Swami Geetananda Giri, used to talk of this, my beloved Ammaji, what she would say, Swamiji, I have to add one more awareness to this. Because before you become aware of the body, emotions, mind, and awareness, you first have to be aware of how unaware you are. So the first awareness is a prerequisite, which is becoming aware of how unaware we are. And this is why when we start the practice of pranayama, we are shifting our awareness. We are deepening our awareness, and that process, which was and is for most people subconscious, unconscious, automatic, autonomic, becomes a mindful process of conscious evolution. Another way to think of yoga is conscious evolution. So most people, they are not thinking of the breath. Why? Because in the back of the head, we have a part of our nervous system called the brainstem. The brainstem, which consists of the medulla, pons, and the midbrain, especially the part which is the medulla and the pons. These parts, they are vital for keeping us alive. And in those parts, we have what is called the respiratory center. So the respiratory center that is functioning in the pons and the medulla, what is it doing? It is keeping you alive. It is keeping me alive. It is keeping everyone alive by making sure that we will breathe. So that brainstem, which has the respiratory center, it is constantly giving a signal to enable us to manifest the process of breathing, the process of respiration. That is what it is doing. It is also doing the function of keeping the heart beating and circulating blood throughout the body. And it is also keeping the third function, which is making sure your food is digested. So three important functions that enable us to survive. Remember, it is survive, okay, not thrive. It is survive. Three functions that are required for survival. You need to breathe. Your heart has to beat and circulate the blood throughout your body, and you should be able to digest the food you have eaten. And all of this is happening from your brain stem, where the respiratory center, the cardiovascular centers, they are all located. Now, this part is only focusing on survival. And in the yogic parlance, survival instinct is one of the pancha kleshas. The pancha klesha called abhinivesha. And Maharishi Patanjali, in his timeless wisdom, tells us, Swarasavahi vidusho api samarudaha abhinivesha. He tells us that this is running on autopilot. Swarasavahi. And even the most learned people, people who should know better, they get trapped in the survival instinct that somehow I have to survive. And this is related to that brainstem. So that brainstem respiratory center is enabling us to survive by making sure that we are breathing. Because if it were not there, let's take the other side. If that respiratory center was not there, what would happen? Imagine 15 to 20 times per minute you have to tell your lungs, breathe in, breathe out, breathe in, breathe out. So luckily, the divine in its cosmic intelligence and wisdom has made this process automatic. You don't have to think about it. It automatically happens when you are sleeping, whether it is swapna or sushupti, or whether you are in jagrat and wakeful, that respiratory process is continuing. Breathe in, breathe out, breathe in, breathe out. So it is all continuing on autopilot. but it is only survival mode. Now we are born as a human being. To be born is the greatest of the rarest of the occasions. So it means that we have to be slightly different than autopilot. We are not a machine to be on autopilot. We are to be a mindful, conscious, evolving human being who evolves from subhuman to human to humane towards our divine nature. And that is why we have to come out of that survival instinct. I like to call it survival mode. The survival mode is the brainstem mode. It's back here. And this is the part that is always concerned about me, and makes us so mean because we are always thinking only of me. I have to survive. My family has to survive. My job has to survive. My ideas have to survive. My institution has to survive. All of this is driven by this brainstem survival instinct, abhinivesha, klesha. But then in pranayama, what is happening? We are moving from the back of the brain to the front of the brain. This area here, it is called the prefrontal cortex. Prefrontal cortex, prefrontal cortex, prefrontal cortex. That's how I teach the children, and they'll never forget for the whole life. This is the area where we have something called Buddhi. We have to become a Buddhiman Manushya, someone who's endowed with the Buddhi. Because what happens? If we are not a Buddhiman Manushya, we will go into Buddhi Nasho Pranaschati, which the Bhagavad Gita says how we destroy ourselves. You need to have an active functioning Buddhi to truly be a human being. So this Buddhi, this is the part which is the prefrontal cortex, the newest part of your brain. This brainstem is one of the oldest part. We call it the reptilian complex. This part is the human complex, the cortex, and especially the prefrontal cortex, where you have the power of discernment and the power of non-attachment. Viveka, Vairagya, they are in the prefrontal cortex. So what are we doing? This is the place where you can make a choice. The superpower of being human. What is that superpower of being human? The power of choice. The power of choice is the superpower of being human. No other life form has the power of choice. We have the power of choice because of the prefrontal cortex, prefrontal cortex, prefrontal cortex. And what is happening in pranayama? We are shifting from survival mode, autopilot, survival mode, and we are shifting into living mode, thriving mode, nourishing mode, enhancing, abundant mode. All of that is happening in prefrontal cortex. And this is why our great rishis were the greatest scientists. They were those amazing scientists who had that amazing antardrishti. They were able to understand that which was sukshma, vyavahita, viprakrishta jnanam. They had that ability to understand that which was subtle, hidden, and distant, because their prefrontal cortex was at the highest elevated level. And so they said, my dear human beings, follow your Manushya Dharma. Be a Buddhiman Manushya. And so they taught us pranayama. Pranayama is not a breathing exercise, mind you. Pranayama is not a breathing exercise. That is the worst possible dumb definition of pranayama, to call it a breathing exercise. Pranayama is the methodology to enhance our awareness of that vital life force called prana. We are enhancing our awareness of prana through the process of pranasya ayamaha pranayama. That ayama is enhancing all the dimensions of prana in our consciousness. And so what did they say? Instead of being on autopilot, shift to your own power mode. Empower yourself. Take charge by your higher consciousness. And so you choose how you are going to breathe, how long you are going to breathe, whether you are going to hold the breath or not, whether you are going to hold the breath after breathing in or breathing out. You are going to make all these choices. So you could either breathe in, breathe out, Sukha Pranayama. You could breathe in, breathe out, hold out, You could do the Bahira Kumbhaka, which we call Shunyaka, and you have the Viloma Pranayama. You could breathe in, hold in, breathe out, where you do the Antara Kumbhaka, where you start to do what is called the Loma Pranayama, and then you could breathe in, breathe out, hold out, which is called Sukha Purvaka Pranayama 4. It is a square breathing. They like to call it square breathing. And what has happened? You have made a choice that you will make sure the inhalation and exhalation is same duration. You will hold it for the same duration. You will hold out for the same duration, creating a steadiness, a dhrida bhumi through the practice of pranayama. Then you may choose, I'm going to breathe in for 6 count and breathe out for 12 count. The traditional ratio 1:2. You may say, I'm going to hold in. So I'm going to breathe in for 6 count. I'll hold in for double that count, 12. Then I'll breathe out for 12. Then you may change, no, I'm going to do breathe in 16. I'm going to hold for 32. You are making the choice. Every time you are making a choice, you may decide, I'm going to breathe out and hold for 32 counts. You may say, I'm going to breathe in and hold for 64 counts. All of these are the choices. You are utilizing the power of choice, which is the superpower of being human. And thus, you are changing your whole neuronal circuits. It is called self-directed neuroplasticity. That is what is happening. You are changing the neuronal circuits of your own nervous system by the choice you are making on how you will breathe. On top of that, you can choose to breathe in right nostril or left nostril or both nostril. When we breathe in through the right nostril, Surya Nadi Pranayama, what is happening? You are starting to work on your sympathetic nervous system. That sympathetic nervous system that is catabolic in nature, that gives you the energy to fight the battle that you need to fight or escape from the battlefield if you're overpowered. All of that energy is from the Surya Nadi, activating you, creating the energy you need for your day-to-day activities. Raudra Karya, says the Shiva Swarodaya. But then you may want to relax. Saumya Karya. You want to do relaxed attitudes, tranquil attitudes. Then left nostril, Chandranadi Pranayama. So you may need Surya Nadi Pranayama at certain times of the day, at certain points of your life. You may need Chandranadi Pranayama at certain points of the day, certain times of your life. And then you can do in right, out left, Surya Bhedana, breathing in right, breathing out left. You can do breathing in left, breathing out right, Chandra Bhedana. Or you can start doing the alternate nostril, Aloma Viloma, Anuloma Viloma, Nadi Shuddhi, Nadi Shodhana, alternate nostril breathing. You are making a choice. Whether you want to work on your sympathetic nervous system or whether you want to work on your parasympathetic nervous system, and by constantly making a choice to work on the sympathetic, parasympathetic, sympathetic, parasympathetic, Loma, Viloma, Surya, Chandra, Ha, Ta, you are constantly creating a state of balance. Samatvam Yoga Uchyate. That Sthita Prajnata, that balance of samatvam is what you are creating. It is called in modern physiological terms, sympatho-vagal balance. The moment you start to work on your breath in a mindful way, the moment you start to use the power of choice to direct the breath in a certain way, desha kala sankhyabihi paridrishto dhirga sukshmaha, says Maharishi Patanjali. All of these choices you are making, you have transcended that brainstem, which is always looking at me, and you have come to thee, and your dhiyo yona prachodayat, your whole higher intellect is coming alive, and you are having that prakasha. And this is why Maharishi Patanjali tells us, what does he say? Tatakshiyate prakashavaranam. When you manifest that practice of pranayama and you come into that state of being, where you are actively engaging your power of choice with relation to the way you breathe, and the way you breathe influences the way the prana flows. At that point, that shroud that was covering the inner light that Antara Prakasha which was there, which is Surya Koti Samaprabha. We say, Vakratunda Mahakaya, Surya Koti Samaprabha. That type of Prakasha is there. But it has been covered by a dark shroud. The shroud of Avidya, Ajnana, and Ahankara, Raspita. And so what has happened is we don't know the light is there. We are looking for the light outside. We want somebody to give us the light at the end of the tunnel or shine the light on us. No. The light is all within each and every one of us. But you have to remove that shroud. What is that shroud? It is the shroud that is happening because you are locked in an instinctive samskara vasana based pattern which is governed by your brainstem. And you have chosen to transcend it. Yoga is all about transformation and transcendence. And if it is not doing transformation and transcendence, I question whether it is yoga, even if it looks like yoga. Because that power of transformation and transcendence is the key energy that lies throughout all the practices, whatever they may be, whether they are the yama, niyama, asana, pranayama, satyahara, dharana, dhyana, samadhaya, ashtau angani, whichever of the limbs, that common refrain that is there, the common link that is there. We are moving by the power of choice. We are changing the neuronal circuitry of our brain. Those amazing trillions of connections are coming alive with self-directed neuroplasticity. And this is why when we use the breath, the utilization of the breath is only so that it is the medium through which the prana can move. You know, one of the issues with glucose metabolism in the body is that glucose cannot go directly into your cell. So your blood vessels, your blood may be filled with sugar, but it needs insulin to go into the cell. If it doesn't have insulin, it cannot go into the cell. And that is why we have diabetes mellitus, because of insulin resistance. What is the issue here? The same type of thing. The breath is the vehicle that enables the prana to flow. So the prana is going to flow, but it needs a vehicle, a vahana. So the vahana of prana is the vayu. That is the breath that we are breathing in and breathing out, and we are manipulating by the power of choice. Because what is vayu? It is the visible Brahman. Tvameva pratyaksham brahmasi, tvameva pratyaksham brahma vadishyami, namaste vayu. That is the teachings of our Vedic literature. So it is the vehicle, the vahana, through which the prana can come, just like the divine, comes through our beautiful temples with the vahana, be it the Mushika vahana or the Mayura vahana or the Simha vahana or the Dandi vahana. What is happening? The vahana is enabling the flow of the energy to manifest. The breath is the vahana, but the actual deity is prana. And this is why we need to understand the breath and enable our mindfulness of the breath to occur. So when we want to breathe, we have the nostrils, we have the back of the throat, the nasopharyngeal region. We come down into the trachea, the larynx and the trachea. And the trachea divides into what is called the tracheobronchial tree. After the trachea, you have the bronchi, the principal bronchi, and they keep dividing so that there are more and more and more divisions. So it is called a tracheobronchial tree. It looks like a tree upside down. So just like a tree has a trunk and then the branches and then the leaves, you have the trunk, which is your trachea, dividing into the bronchial branches. And then finally, the leaves are the alveoli. So you just have to reverse it. And what do the trees love? They love the carbon dioxide. What do we need? Oxygen. Trees give us oxygen. We give them carbon dioxide. A beautiful, synergetic, symbiotic relationship between humanity and the trees, which is why we must stop cutting down the trees. And if you have to cut it for some reason, plant at least 2 or 3 trees for every tree you cut down. Because if we don't have trees, we don't have life. There's a joke I read recently that they said, too bad trees don't give off Wi-Fi. Because if trees gave off Wi-Fi, we'll be planting them everywhere. It is too bad they only give us oxygen. We are more interested in Wi-Fi stations than in oxygen that enables us to live and thrive. So the tracheobronchial tree comes into the structures of your lungs. And you have a right and left lung. And both of these lungs, they are sitting on that massive muscle, a grand muscle, which is your diaphragm. So the diaphragm is dividing the abdominal cavity and the thoracic cavity. So you have the thoracic cavity above the diaphragm, abdominal cavity below the diaphragm. It divides the thoraco-abdominal cavity. And because they are attached to the diaphragm by the pleura, which is like a thin, sheet covering it, what happens is whenever the diaphragm moves down, when the diaphragm contracts, it moves down. So when the diaphragm moves down, the lower part of the lungs has to also move with the diaphragm, because it's married to it. They tie the dhoti, the angavastram of the bride, the bridegroom with the sari of the bride, and they have to walk the saptapadi. Same way, your lungs and your diaphragm are tied together, no escape. So when the diaphragm goes down, the lower part of the lungs has to go down. Similarly, your intercostal muscles that lie between your ribs, they pull out, and when they pull out, the rest of the lung has to stretch sidewards. Sidewards, backwards, frontwards, all directions, 360. Remember, your lungs are 360 degrees. They are not pasted on the front of your body. And then come in these muscles up here, which are the accessory muscles that enable a pulling up, and the upper part of the lungs can be pulled. So you have the diaphragm going down, the lower part, the intercostals going outward, the mid part, and the accessory muscles pulling. This is the upper part. Now in yogic parlance, the lower part is adama, the middle is madhyama, and the upper is adhyama. So adama, madhyama, and adhyama, three parts are manifesting the action with every breath. So how is this happening? The brainstem, it sends a signal to these muscles of respiration. And because of that signal coming through the phrenic nerve, the phrenic nerve is the most important nerve that supplies the diaphragm. And if you have a trauma in the neck and the phrenic nerve is damaged, you will not be able to breathe. Because if the diaphragm doesn't move, basically you need to be on a ventilator. It's as simple as that. So the diaphragm is the most important muscle of respiration. So what happens is, when the signal comes, the diaphragm goes down, the intercostals go out, and the accessories pull up. So what has happened? The whole chest cavity, thoracic cavity, has expanded in size. So the volume inside your thoracic cavity goes up. Okay? It's like a big barrel that has expanded. So what has happened? The volume has gone up. Now in physics, there's a law called Boyle's law, after the scientist. And what it says is, when the volume goes up, pressure will fall. So the volume goes up, so the pressure falls. And because the intrathoracic pressure is relatively negative compared to the outer atmospheric pressure, air rushes into your lungs. So next time you think you're breathing in and pulling the air in, remember, what you're actually doing is the muscular movement is creating a change in the volume, that is creating a change in the pressure, and the air is just coming into you. It's actually very interesting. This is why the primary focus that you need to start when you start pranayama sadhana is on understanding this musculoskeletal movement that is governed by the neurological circuits that is enabling us to breathe. So the lower part of the lungs, the middle part of the lungs, and the upper part of the lungs as you breathe in. Now the respiratory center, what it does is it tells you to breathe in. So it actually forces you to breathe in. And you have no choice. Hey, breathe in, breathe in. If you don't breathe in, I'll beat you up. Like that type of hatha. It is forcing you to breathe in. So it is sending a message, diaphragm goes down, intercostals, all change occurs. You have The air has come in. Now at one point, the pressure inside your thorax and pressure outside, atmospheric pressure, has become equal. So now what will happen? It stops sending the signal. It says enough, satiety, hodon, tripti ho gaya. So now what happens is it stops sending the signal to the muscles, and hence the lung that has expanded, the whole thoracic cavity that has expanded, it just by elastic recoil. Just by elastic recoil, you are breathing out by elastic recoil normally. So the inhalation is active because of the brainstem signals to the respiratory musculature. Expiration is passive normally, and it is by elastic recoil. And now what is the most important muscle of respiration? Diaphragm. Hence, both inspiration and expiration, the diaphragm is playing the major role in our breathing in and breathing out. And this is why there is a lot of controversy. Do you breathe into the low, mid, high, or do you breathe into high, mid, low? Or is it low, mid, high, and high, mid, low? So much confusion because people are trying to understand the air particle. It is not the air particle that matters. It is the awareness of the muscular action that is enabling you to breathe that is primary here. And this is why we need to work on the different bhaga, the different parts of the lung, by developing what is called Adama Pranayama, where your mind is focusing on the lower part of the lungs. Madhyama Pranayama, when you focus on the middle part of the lungs. Adhyama Pranayama on the upper part. And then you bring it all together. What is it to bring it together? Mahat Yoga, the grand yogic integration of low, mid, and high happening in Mahat Yoga Pranayama. So here, whether you are breathing in or out, the primary action is your diaphragm. Hence, always the awareness is to be in the low, mid, high, and then low, mid, high as expansion and contraction. Expansion of the thoracic, contraction of the thoracic. And this type of dynamic flow is happening. As the diaphragm goes down and up, the intercostals go out and in, and the accessory go up and down, all governed by your brainstem. But now when you want to practice awareness, the power of choice, you start to say, I am not going to let expiration be passive. I'm going to make expiration also active. This is where we are changing the dynamics, because the yogi wants to change the dynamics. We already know, according to the Bhagavad Gita, Ya Nisha Sarva Bhutanam Tasyam Jagrati Samyami Yasyam Jagrati Bhutani Sa Nisha Pashyato Muni. We know that the perspective of the yogi and the perspective of the common Samanya person is opposite. Upside down. That's why the yogi is on the head, Shirsasana, and not on the feet all the time. We want to change. We say, okay, normally it is active inspiration, passive expiration. Let us make expiration also active by bringing the mind into it. And we start to regulate our breathing in and we regulate our breathing out mindfully, utilizing all of these sections, the lower, mid, and the upper parts of your lungs. This is where we are bringing in the most important concept, which is Yato Mana Tata Prana. Where the mind goes, the prana will flow. So you are becoming mindful of these neurodynamic mechanics, the mechanisms of the muscular dynamism followed by the neuronal signals. The neuronal signals followed by the muscular dynamic changes that are leading to pressure volume changes. You are becoming aware of it and you are learning to deal with it in a mindful, aware manner. This is the beginning. This is the base. This is the Dhrida Bhumi on which you build a pranayama sadhana. What I find is many people want to directly go into the Ashtakumbhakas. They want to start off straight away with Anulom Vilom Nadi Shuddhi. First of all, they are not breathing at all. If you have never focused on your breathing, if you have no awareness of your breathing process, and you do just alternate nostril breathing, there is no breath moving. If there is no breath moving, there is no prana moving. And then how can you even call it a pranayama? It is a finger nose exercise, that's all. Maybe your fingers and your nose will look good, that's all. But you are not moving any breath, you are not moving any prana, because you have not even learned how to move the breath in the first place. This is why we need to understand this anatomy and meta-anatomy, physiology and meta-physiology of how these things are working. On the left side, people always say, oh, you have one lobe less. Because on the right side, you have 3 lobes, on the left side, 2 lobes. See, this is only the external, gross anatomical difference. But if you go into the lobes and you look at the bronchial, tracheobronchial pathways, and you start to look at what we call bronchopulmonary segments, you will realize that right and left lungs are equal. Because we have these lobes, and each lobe then has multiple smaller areas called a bronchopulmonary segment. A bronchopulmonary segment is an area that has its own passage for the air, a bronchial passage. It has its own artery, it has its own vein, it has its own neuronal supply, it has its own lymphatic supply, and it is like its own unit. It's like a district in a state. So think of the lobe as a state. All the lobes together, all the states together is your country. Your whole respiratory system is your country. Each lobe is the state. Within each state, you have the districts. Those districts which have a district taluka with a court, with a hospital, with all the facilities. Similarly, you have bronchopulmonary segments in your lungs. And your right lung has 10 bronchopulmonary segments, and your left lung also has 10 bronchopulmonary segments. So no lung is better than the other or lesser than the other. And in fact, if you come to the left upper lobe, because there's only upper and lower, there's no middle lobe in the left side gross anatomy, you will find in the left upper lobe, there is an area called the lingula. Lingula means a tongue. It's tongue shaped. That area functions like a middle lobe. Inside that, if you look at it, the bronchial divisions of the lingular area are similar to the bronchial divisions on the right side in your middle lobe. So it is only the external part, because I know so many times when we teach the vibhaga pranayama and we said we breathe into the low, then we said we are going to breathe into the mid chest, and immediately one of those students who thinks they are very smart, they're just smart alike, they're not smart. They will say, oh, Dr. Ananda, you are a doctor, you don't know on left side there's no middle lobe. I'm like, the joke's on you, my dear. The joke's on you, because there is an equivalent area that is physiologically functioning like a middle lobe. Hence, when we say madhyam pranayama, breathe into the mid part of the lungs, you are not saying something wrong, because there is a functional middle lobe on the left also, just like the gross middle lobe on the right. These bronchopulmonary segments, they captivated my interest as a medical student, because when I started studying medicine in Nagpur University, JNMC Varda, Savangi, I remember that it was captivating for me, because I had trained with my father for 2 years, officially as a student, though from right the childhood I was training with him unofficially, maybe from treetops. But I studied with him 1991 to 93, officially as a student. I had all this yoga knowledge when I went into medicine, which is different than many medical doctors who have medicine and then come into yoga, and they apply the medical reductionist approach onto yoga. When I went into medicine and I saw that these bronchopulmonary segments were there, I was so happy, because we learn what is called vibhaga pranayama. Bhaga means a part, vibhaga means a subsection. Bhaga is a section, vibhaga is a subsection, and we have 10 subsections, bronchopulmonary segments on each side. Now, when we do the yogic full complete deep breathing of vibhaga, we do the front of the lower lobe, side of the lower lobe, back of the upper lobe, back of the lower lobe. Similarly, front mid, side mid, back mid, front up, side up, back up. So you have 9 vibhaga on right, 9 vibhaga on left. And when I saw these bronchopulmonary segments, I'm like, wow, this is exactly what our mantra drishtas, those antara Jnanis, Antara Jnanis, those Rishi Munis, they have perceived. They had perceived these bronchopulmonary segments and given us methodologies to work in them. Because when you place your sparsha mudra, the hands on the front of the lower chest, your mind is focused there, your mind anchors there. You are starting to enhance the flow of the breath and the prana into that region. Now you will say, Dr. Ananda, you said there are 9 vibhaga but 10 bronchopulmonary segments. When I was studying medicine and I came to know of this whole thing, what is very important is at that time itself, that was in 1993, we had textbooks that said maybe there are 8 in one side and 8 in the other. They were starting only at that time, 30 years ago, about 8 and 8. Then the later textbook said 8 and 9. Another one said 9 and 9. Another one said 9 and 10. And it is only by the time I completed my medical training and came in my internship in around 1998, 99, I started practicing. That is actually when this 10 and 10 came into being. So, you know, the fact that our rishis could understand 9 vibhaga, nava vibhaga in each of the lungs thousands of years ago, it is like landing a helicopter on a pin. That is the type of precision they had. And I was talking about this to a senior member, Rajudev, in our tradition. And he said, do you know, Dr. Ananda, your father, Swami Geetananda Giri, taught that there are 3 antara aspects of the lobe also. So along with this front, side, back, front, side, back, front, side, back of low, mid, high, there is also the inner low, inner mid, and inner high. So it means there are actually 12 vibhaga, which means science is still catching up with yoga. Amazing precision. And when we start to do the sparsha mudras for each area, it is astonishing how when the mind comes into it, we can transform the way people breathe into a healthy manner. So this was one more concept I wanted to give you. And another concept is that there is something called ventilation perfusion. What normally happens for most people is the air moves into the upper chest. So the upper chest gets the air, but because we are constantly sitting, standing, and moving around on an erect position, we don't have adequate perfusion. The blood flow is not so good in the apical region, the upper part of the lungs. So there is an imbalance between ventilation, which is the air, and perfusion, which is the blood. So the upper parts of the lungs get the air but don't have the blood. The lower part of the lungs have a lot of blood, but they don't get the air. This is the normal problem that we have. So the upper part, the air is there, but not enough blood. At the lower part, the blood is there. Why is blood there? Because of the gravity, erect position, but the air is not going. So there is a ventilation perfusion imbalance. And this is a major problem people have. What did the yogis said? Let us set it right. Because they don't like imbalance, they only like balance. Yoga is all about balance. We don't want sympathetic dominance, neither do we want parasympathetic dominance. We want autonomic balance. So what did they say? Bring your head down below your heart. The moment your head comes below the heart, you have changed the way the blood flows into the upper part of the lungs. You think of any of the inverted postures, the topsy-turvy inverted postures where the head is below the heart. Something as simple as Meru Asana, where the head is below the heart. People call it Adho Mukha Shvana. No, Meru Asana or Parvatasana is the correct terminology for it. Similarly, Shashangasana, where the head is down below the heart. Padahastasana, also called Apanasana and Uttanasana by different people. Head is below the heart. You then come into Balasana, Nikunjasana, lying down like a baby. Head is below the heart. Then you can come into asanas like Viparita Karani, the Mudra Viparita Karani. You can come into Sarvangasana, Halasana, and of course, Shirsasana and Kapalasana. So many practices where the head is below the heart. The moment you bring the head below the heart, you are resetting the ventilation perfusion imbalances. Because suddenly what is happening? More blood is coming to the upper part of the lungs. And the air can flow into the lower part of the lungs. So both the deficiencies are being taken care. The seesaw is coming into a balance. It's neither here nor there. Remember, Yuktahara viharasya. It has to be yukta, it has to be mitahara. Yoga is not for someone who eats too much or doesn't eat or doesn't sleep or sleeps too much. It's not the extremes, it is balance. And this is where bringing the head below the heart is so useful. A whole series of practices, 15 practices are found in our tradition called the Hattena. Hattena, that by which you are forcing the breath into these different parts of the lungs, where you can do practices to enhance the functioning of the lower part of your lung, enhance the functioning of the middle part, enhance the functioning of the upper part, and bring it all together by enhancing the combination in the Mahat Yoga Pranayama. Amazing practices, and we have shown in research that these practices are very useful in people who have chronic lung disorders, chronic obstructive lung disorders, and people who have what is called diabetic lung, where due to diabetes, the lungs are not functioning at their peak level. When you do these practices, a series of practices that are based again on the concept of yato manat tata prana, and you're putting your body in certain postures. For example, the postures that we do of the Ushtrasana, the camel posture variations for the lower lung, the Matsyasana, the fish postures, variations for the middle lung, and then coming into the Balasana, the Nikunjasana, and two practices which are called Mahamudra 1 and 2, where you are helping to expel the stale air that is trapped in the lung. Many people who have lung disorders, the problem is the lungs are already hyperinflated. You go and look at the X-ray and you will find the lungs are hyperinflated. Because the lungs are hyperinflated, they cannot breathe in. And that is why it is very important to teach people how to breathe out mindfully. The Bhastrika Pranayamas, or Kapalbhati, or Nasarga Mukha Bhastrika, breathing in the nose, out the mouth, or the Mukha Bhastrika, where you breathe in, and Mukha Bhastrika, Dauti Pranayama, you empty the lungs. By emptying the lungs, you have dealt with that hyperinflation. And then the person, when they breathe in, they can take in a Purna Shwasa. They can take in a complete breath. Because most people who cannot breathe in, the problem is because they are not breathing out effectively. Remember, breathing out was passive. So it is like a rubber band. You take a rubber band, you stretch it, actively you stretch it. When you want to let go, you just let go, it will come back. You don't have to go and push it back. You pull the rubber band apart, active inhalation, and you have to just let go, passive. You blow a balloon, it becomes big. When you want to let the air out, what do? You just have to let go. When you let go, what happens? Comes back. So this is the normal process. So because the people are not breathing properly, they are not breathing out properly, then they cannot breathe in properly. So teaching them to breathe out properly is a very important part of how you can then help them to breathe in properly. And so many times, the Bhastrikas, especially the Mukha Bhastrika that I said, where you breathe in and then you blast out multiple blasts. The Mahamudras, where you expel the stale air that is stagnant and, holding up space. It is holding space so nothing can come in. You have to expel it so that something new can come in. And then we bring it together in the Vibhaga Pranayama, the tiger breathing. Some people call it the cat and cow. What an insult. It's not cat and cow at all. I don't know how Vyagra, which is a tiger, became cat cow. It is an insult to our Indian sensibilities of our Samskriti that we let people call it cat and cow. Vyagra Pranayama is the tiger breathing. And in that, the low, mid, and upper parts of the lungs, they are yoked together as you breathe in and breathe out. And then the Sharabhasana and the Chiri Kriya are brought in that are enhancing the functioning on right side of the lung, left side of the lung. Thus enhancing, yoking all aspects of the vibhaga so that you can make a Purna Shwasa. Because if you are not breathing properly, you cannot be healthy. Every cell, people tell me, oh, Dr. Ananda, so these Hattena practices, they are good for breathing disorder. Yes, they are good for breathing disorder. But it doesn't mean they are only good for breathing disorder. They are good for everything. You are healthy, you want to remain healthy, Hattenas are useful. You are not healthy, you want to become healthy, they are useful. It doesn't matter whether you have diabetes. That is why we did diabetic lung. And we saw along with the lung function, the blood sugar control was better. Because what is happening? Every cell in your body needs oxygen. It needs perfusion. And if you are not breathing properly, your tissues are not perfused. The last thing I wanted to share here is the fact that we are shallow breathers. We are shallow breathers. We are not breathing even 10% of our capacity. Our capacity should be at least 4 to 5 liters. 4 to 5 liters, 4,000 to 5,000 milliliters of air should be taken in and let out in each breath. We are breathing about 250 to 300, at most 350. Now, if you are given 10% of your salary, you are not going to continue your job. If your students come 10% of the time to class, you are not going to give them attendance marks. You will most probably fail them. But we are so blissfully, ignorantly happy despite breathing less than 10% of our lung capacity. This is why our brain capacity depends on how we are breathing. The tissue perfusion depends on how we are breathing. Our kidneys, their function depends on how we are breathing. Every cell in our body, trillions of cells, they are depending on how we are breathing. And this is why when we learn to breathe properly, through the vehicle, the medium, the Vahana of that Vayu, the prana can flow and energize each and every one of those cells. Because every cell has its panchakosha. And you want all the cells to be alive and thriving. You don't want to be in survival mode. You don't want your cells to be just surviving. You want your cells to be thriving with abundance. And that is why we need to work on this again and again. And what we find is normally when people breathe, and they are very shallow breathing, say they breathe at a capacity of 500 milliliters each time. Now that is not much, but still, what happens is because they are breathing shallow, what is happening? They are having to breathe many, many times. And they are breathing many, many times. Because they are breathing many, many times, what is happening is they are using up more energy than they are gaining. It's a simple accounting issue. If you are wanting a capacity of say 6,000, okay, you want 6 liters. Now, if you have someone who is breathing 30 times and they are getting 200 each time, 200 into 30 is 6,000. So 30 times they have to breathe to get 6,000. Another person is breathing at the rate of 500. So now that person breathing at the rate of 500, they have to breathe 12 times per minute, 12 into 500 to get that same 6,000. And now imagine you are breathing at the rate of 1,000 with each breath by a nice deep breath. Very easy to do. 1,000 is nothing. A nice deep is 1,000. And you want 6,000, 6 breaths per minute are all you need. So by deep, slow breathing, deep breathing is energy efficient, because what has happened with 6 breaths, you have got the same 6,000 that a normal breather needs 12 breaths to get 6,000, and a shallow breather needs 30 breaths to get that 6,000. So someone is doing 30 breaths to get 6,000. You are doing 6 breaths to get 6,000. Imagine how energy efficient you become. And on top of this, we have an income tax, TDS, tax deduction at source. Same type of thing we have with our breathing. It is called dead space volume. So whenever you breathe in, one part of your respiratory tract, from the nose to around the 17th tracheobronchial division, the air is only traveling, there is no exchange. After the 17th division, that is where the exchange occurs. The actual tissue respiration in the lung occurs. So the air that is in this is called a conducting zone. It is the conducting zone from the nose to about the level of 17th division. It is conducting zone. After that is respiratory zone. So the air in the conducting zone, every breath you need 150 milliliters for that. So every time you breathe, 150 milliliters is going to be deducted at source. So imagine this poor person breathing 30 times per minute. So 30 into 150, 4,500 has gone in TDS. Out of 6,000, they have only got 1,500. 30 times they have been breathing to try and get 6,000, but 4,500 went in TDS. Their final in-hand salary is 1,500. So all that energy expenditure and what you have got is a pittance. No wonder we are unhealthy as a species. Look at that second group. What has happened to the second group? 12 times they have breathed for that same 6,000. So 12 into 150, which is about 1,800. So they have lost 1,800 in TDS. 1,800 in TDS out of 6,000 they have lost. 4,200 is what they got. So they got something better. They are surviving. But then look at that intelligent yogi. Through the yoga, abhyasa, pranayama, sadhana, what has happened? Only 6 times you have breathed. So 6 into 150, only 900 ml has gone TDS. The balance 5,100 you have got in hand. You have only breathed 6,000, 6 times per minute, energy efficient. What you are getting in hand, 5,100. What was detected? Only 900. Compared to the shallow breather who got 1,500 for all that work of 30 times. This is why slow, deep breathing is healthy, energy efficient, and it is the way forward if we want to be healthy as a species. So I have tried to share some of these concepts that are vital when we want to understand the anatomy and physiology of the breath and how it correlates with our concepts of prana and pranayama. So I think at this time we can go over to some questions and a discussion, and I think this is a perfect time for that transition to occur. Namaste, Vinayaji.